Hi, I'm Andrzej Gurowski, Vice President of Solution Strategy here at InTouch. In response to the overwhelming demand for telehealth solutions by local governments and healthcare providers around the world to address the COVID-19 pandemic, InTouch Health is responding with a complete end-to-end virtual care offering leveraging our Solo by InTouch software platform. We will be charging a single setup and configuration fee and will be offering 4 months of free user access to Solo by InTouch. Within less than 24 hours, we can deploy our cloud-based software to enable end-to-end patient care, as well as a virtual COVID-19 screening. Our software platform addresses 4 main use cases for both patients at home and those inside of facilities. Solo by InTouch allows hospitals and health systems to offer a virtual-first patient assessment to make sure only appropriate cases are coming into your facilities. Customers can put a link and directions on their websites to allow details and symptom information. This intake process has been customized for patients that are suspected of having COVID-19 symptoms. We have designed 2 different options for our customers. The first option is for a patient to complete the intake process and go directly into a queue to complete the intake process and go directly into a queue to be seen by a practitioner. This workflow will allow our customers to fast-track patients directly to a provider. The second option is for a patient to complete the intake process and be presented with a list of available appointment slots for which they can sign up to see a practitioner in the future. Once they schedule, they will receive an email link to join the session at the appropriate time. This workflow will allow our customers to schedule patients where demands are high. Alternatively, call centers or nurse triage hotlines can be used to assess patients via phone calls to determine if a virtual COVID-19 visit is required. The call center or triage hotline nurse can schedule a virtual appointment directly in Solo. Additionally, this workflow can be configured to limit on-site visits for vendors, family members, and any non-essential visitors. Solo by InTouch allows hospitals and health systems to manage follow-up appointments and medication refills that can be done virtually in order to minimize spread. Customers have concerns about managing their existing patient volumes, and as such, Solo by InTouch can be leveraged to schedule patients for these follow-up visits. In this workflow, administrative staff can schedule virtual visits for their existing patients, and their patients will receive an email link to join the session at the appropriate time. Once the patient joins, the provider will be notified that the patient is ready to be seen. Also works very well within facilities. Leveraging the power of our web viewpoint capabilities, customers can turn existing laptops or tablets into virtual care endpoints. A customer can designate as many endpoints as they'd like. Once they register the device in our system, that device now becomes a gateway into Solo. Upon activation, a local practitioner can step through a series of intake questions for COVID-19 screening, and then patients will be put in a queue to be seen by a remote practitioner. This workflow will allow our customers to manage in-facility patient volumes in places like urgent care centers and clinics while keeping practitioners remote. Solo by InTouch can also be leveraged for patients that have been admitted into facilities and may be under observation or in isolation. In this workflow, remote providers may not want to wait for a request to come in from the on-site staff, so they have the option to directly connect to the endpoint on demand. This workflow provides complete flexibility in accessing patients whenever and wherever they are. These 4 clinical offerings have been packaged up and pre-built for our customers to gain access to immediately. Because it is pre-packaged, we can deploy this solution very rapidly, but we will also be limiting customizations and will not be performing integrations with EMRs. We have provided documentation and training information to allow our customers to set up and expand their programs rapidly across their systems and to meet the demands at increasing volumes that are creating challenges for scale. We are all in this together, and we're working hard to ensure that we do everything we can to support our customers.